Welcome to the webinar, Unequal Prospects for Working Longer Before and After the Pandemic. What do we need to do? Today's program was organized by the Sloan Research Network on Aging and Work. The webinar is being recorded and will be posted on the GSA website. A notice to all attendees will be distributed once the recording is available. A question and answer session will immediately follow the live presentations. We will be accepting questions through the questions feature accessible on the right-hand side of your screen. Also located there are downloadable handouts for today, copies of the presentation slides and bios. Opening today's program is Dr. Cal Halverson, Assistant Professor at the Boston College School of Social Work, an affiliate of the Center on Aging and Work at Boston College, and a Senior Research Fellow at encore.org. Cal?
Great, thank you so much, Judy, and welcome to everyone who is joining. As Judy said, my name is Cal Halverson, and I'm an assistant professor at the Boston College School of Social Work. I'm also a steering committee member of the Sloan Research Network on Aging and Work. And the Sloan Research Network is an international, multidisciplinary research network of scholars focused on the changing circumstances of work in later life. We were established in 2014 with a grant from the Alfred P. Sloan Foundation and have since grown to include more than 300 members from more than 20 disciplines in 26 countries. And over the past couple of years, we've increased our focus on the most vulnerable of older adults and older workers. Jackie James, the director of the Research Network, led the planning of this session and had intended to facilitate it. Unfortunately, due to a family emergency, Jackie could not join us today and asked me to step in. However, if you'd like to learn more about our research network, please contact Jackie at the email address on this page, or of course, simply Google us, head to our website, and you'll find our contact information there. So our panel today includes a phenomenal group of scholars. Our presenter today will be Teresa Ghilarducci, a labor economist and nationally recognized expert in retirement security at the New School for Social Research in New York, where she is the Irene and Bernard L. Schwartz Professor of Economics and Policy Analysis. And at the New School, Dr. Ghilarducci is the director of the Schwartz Center for Economic Policy Analysis, as well as its Retirement Equity Lab. Now, I am personally a regular user of her center's website and research and highly recommend it. Of special note to today's discussion, Dr. Ghilarducci just last week published an op-ed in the Los Angeles Times that described the growing disparities among older adults while proposing the creation of an Older Workers Bureau to identify, investigate, and interpret the older working population's concerns while coordinating federal and state policies to help them. We also have an exemplary panel of discussants, including Mo Wong, the Lanzalotti McKeithen Eminent Scholar Chair and Professor of the Warrington College of Business at the University of Florida, where he also serves as the chair of the Management Department. He is also the editor-in-chief of the journal Work, Aging, and Retirement. And Courtney Coyle, a professor of economics at Wellesley College and a research associate for the National Bureau of Economic Research, where she serves as co-director of the Retirement and Disability Research Center and co-director of the NBER International Social Security Project. And fortunately, Ernest Gonzalez, an associate professor at the NYU Silver School of Social Work, could not join us today due to some issues with internet connectivity. So this just shows the joys of the virtual world that we all live in. So we will miss him. So on to today's agenda. In today's quick hour, Dr. Ghilarducci will provide about a 20-minute presentation on the false assumptions supporting the working longer agenda, with a focus on those most affected by the pandemic, including women and racial and ethnic minorities. Then our panel will provide commentary that includes specific recommendations for ameliorating the consequences of the pandemic and the ensuing recession. So with that, I will pass the mic to Dr. Ghilarducci. Teresa.
Yeah, thanks a lot, Cal, for that gracious introduction. I am really glad to be an economist among such a diverse audience. I've always enjoyed going to the GSA meetings. I've learned a lot that I did not know that's never covered in economics, and I'm always inspired to be practical, pointed, and also, quite scientific. Today, I'm going to do something a bit different. And I really do rely on Mo and Courtney to give you some up-to-date data on what's happening to older workers who are vulnerable, mainly those without a college education in the pandemic. But I wanted to use my 20 minutes here before this august audience to bring up 3 issues that really span the American framework for setting policy, really sets up a framework for us researchers. And I really want us all as researchers to step back, look at this framework. And if you're taking notes, I'm going to discuss 3 myths about the working longer agenda that we've all kind of absorbed. Now, we have to hold 2 paradoxical things in our mind at the same time. You're going to listen to me and listen to us that it's very important that every adult who wants to work has a job in America, and we should have policies that support their work. Every adult who wants a job should work, free of bias, free of bigotry, free of limitations. However, counting on work to save us from wholly inadequate policies for pensions is not a good strategy. And that's what I'm here today to talk about. I'm not anti-work, I'm anti-depending upon work to solve all of our problems. Now, there are 3 myths that we have absorbed that keep this kind of working longer agenda on the horizon that makes it not imperative, and it should be, to improve our pensions. One is that if people work longer, they'll get higher Social Security benefits, they'll save more for their pensions, and when they finally decide to retire, remember, they decide to retire, then they will have more income and be healthier because they've had all that engagement. Careful research on our part, and now I'm seeing others as I'm reviewing papers as they're coming to me, have noticed that people work longer but collect their Social Security benefits. Half the people, and more than half of the people at lower incomes without educations, collect Social Security while they're working. They aren't subject to the earnings test, or if they are, they still collect what they can. And that's because the wages and working conditions they're under while they're working have eroded so more. So here they're in a pretty bad situation. They are collecting their Social Security early, taking the hit on their benefits for the rest of their life, and they're subsidizing their low-wage employer, thus encouraging the employer to keep the wages low. Here is actually data that I did a year ago, and now I read 2 papers in review that have the same data. It's kind of complicated, but all you have to do is see the, I think it's green line, the kind of chartreuse line. That's percent of the population not working, meaning they're retired. And the people that are already claiming. So you see that people at every age started to claim before they withdrew from the labor market. I have a number of other slides that show how that's distributed, but that's just the high level point. The next slide, please. Myth 2 is that we're all living longer, therefore we should work longer. I hear it, at Thanksgiving dinner table. I hear it if someone asks me at a cocktail party what I do, then I try to explain the working longer consensus and really trying to engage. They say, well, we're all living longer. That means that even if people work longer, they'll have a longer retirement time. So I've spent quite a bit of work, and it was difficult, especially in the early times, because in the health and retirement survey, not enough people have died. So I couldn't see eventually how retirement time was distributed. But the good news is we wait long enough. The last wave of the HRS gave me enough time to see who actually had retirement time and what kind of health were they in when they were spent in retirement. And I published it in what I call Mo's Journal, the new journal on retirement, wealth, and work, right?
Work, aging, and the retirement.
Aging and retirement. So I should know that's my favorite journal. If you can show the next slide, these are a little more complicated. but it's intuitive. People at the lower end of the socioeconomic status die sooner. They also have less retirement wealth. And both those things, mortality and retirement wealth, have become more unequal. This is sort of my money slide. And this is the intuition that I'm putting numbers on, is that society has gotten more unequal, not in terms of just income, but also wealth, and also because of healthy lifespan. So you put those two things together and you use a high quality data set like the HRS, and I find stratifying people by education, because that's more permanent than income and wealth, I find that low education women have 15.5 years of retirement time, 15.5 years. And the time they spend impaired, the blue line, is 35% of that time, 5 years, over 5 years of that time, they have 2 or more ADLs. But high education women, so just take it by sex, much higher socioeconomic class, they have a good 4 more years, and they spent only a fourth or a fifth impaired. So I want to actually blow people's mind and say, forget about the differences between men and women and take it out of your mind. The sort of women live longer than men, as if that explains the reality, and look at the situation by class. Lower education men, the same division. I've stratified this by race. I need more data samples to be really convinced that I'm picking up a significant racial feature and not just class feature. But it's even worse. That low education men have about 13 years of retirement time, higher education men 14 years. So not everybody is living longer, and the gains to longevity and the gains to low morbidity have really gone to white men as they have quit smoking and taken their statins. And I think everyone here can agree. So let's go to the next one. Next slide. I'm going to throw a regression analysis at you, and this was in Moe's journal, published in Moe's journal, that I looked at like the factors that determine a lot of retirement time. How long am I going to be retired? And that's, of course, the time you retire, the age at which you decide to retire, and the age at which you die. How much of the time was spent being sick, and who actually never got to retire? I'm thinking this inequality is underreported, and I would like to write something about this. That we saw a significant share of Black men and women never making it to their 60s. I think it's about a 10% hazard of not even making it. They drop out of our sample, and so we don't even measure that as an inequality. So I really want to step back and say, because we're only looking at people who retired and then died at 52, we're missing a whole population of missing people who are non-white. Being Black does take away from your predicted retirement time, but having a defined benefit plan, over and over again, these regression statistics popped out that actually having an institution called a defined benefit plan that is quite prevalent among people without college educations meant that you could actually retire early before you got sick, bridge your time into Social Security, and then your morbidity didn't take away from your retirement time. So it turns out, I think this signals to policymakers that if we continued our policies to let people retire in actually their early 60s, and for these folks, coal miners, auto workers, they were retiring at 59, they at least have a chance to have some retirement time and to equalize something we forgot to celebrate, which is as Social Security and pensions came on board in the 30s, we actually were equalizing retirement time, an important human attribute, and we forgot to celebrate it. Having no retirement time probably predicted that you worked longer than died. Being married helped a lot. Being sick, I didn't find a racial component yet, but having a defined retirement benefit plan over and over again. These institutional arrangements predicted that you probably wouldn't be as sick as when you retired. And the prediction that you would die in your boots was much less if you had a defined benefit plan. So these regressions over and over again, I was looking for, demographic variables, but over and over again, I saw these institutional variables becoming really important. So if you can advance it to the next slide. I wanted to really respect the conference organizers, the webinar organizers' edict to look at the distribution of healthy retirement time. So I explored this data set to see, okay, on average, how much healthy retirement time do we expect by state? And I've highlighted the averages over the states, and it's 14 years for whites, only 11 years for blacks. And then I have a column. You can write me if you want to see all 50 states about which states were worse for blacks relative to whites. And this gets at the racial equity question on healthy life expectancy. So there's a gap. It differs by state. Let's explore the state differences that cause these gaps. But I also want to bring it up a bit and say, we might be wrong if we had ever said, you might spend a third of your years not working. I don't see any evidence for that. The retirement time expectations are 15 years, 20 years. Here on average for healthy retirement time, it's only 14 years and 11 years. So I just want to say to all of us, to say that we'll spend a third of our time retired is just not showing up in the data yet. It's just not there. The next slide, please. The third myth is that jobs are getting easier. Therefore, people can work longer because of computerization, maybe because of, I don't know, OSHA. Somehow we're protected. We spent a lot of time in our lab looking at the distribution of paid time off for older workers versus younger workers, the ability to ask your boss for flexibility that goes beyond just paid time off. And we're seeing disparities by age. Older workers, especially without a high school education, a college education, not high school, college, were not able to have these flexible time. So in just that term, being able to accommodate your care needs, being able to accommodate getting sick and not coming to work, and being able to accommodate your work to perhaps deal with your age is not available to older workers. If I could show you some evidence for that, if you can advance it, please. And this was inspired by Richard Johnson at the Urban Institute, who used a pretty nifty part of the HRS. ONET is also an important aspect. This is the 250 characteristics of jobs. And I've had a couple of students that have looked at the characteristics of job by age and by class. But here's just an easy thing to put on a slide, is that work is getting worse, physically worse for older women. So that awful green color is for 1992, and then 2014. We have the data that's more recent, but the trends aren't differently. 26% of older women have jobs that require physical work. Stooping and bending is actually what we looked at to characterize physicality. For men, it has gotten a little bit better. For Black men, it's gotten worse. Why stooping and bending for women? We think it's warehouse work. It's Amazon warehouses. And then the Academy Awards and Hollywood very nicely put an image, a story to this graph, and that's No Man Land, where the award-winning actress is shown to be working at a Amazon warehouse at which she needs to fill in her time. Remember, all those workers in that movie, that Academy Award-winning movie, were people who had lost their jobs, lost their income in the 2008 recession. So I suspect kind of another movie in the next 4 years, looking back at this recession in older workers, and it might be called the tale of two retirements. And that's what actually Courtney might talk about, are people who have been pushed out of the labor market because of this pandemic. Now, the last slide, please. I'm coming near my time. Again, more evidence by Black and White that physical effort has not abated. I don't even have to go through the slide, just look at it. 1992, 2014, just no change. That's what you see here among whites and blacks. So computers have not made the physical demands of older workers any better. It looks like the growth in the sector of warehouse work has made stooping and bending a lot worse. And the computer has also caused a lot of demands on intense concentration and keen eyesight. So in other ways that we can look at stress levels, and this is that data and work needs a lot of, deserves a lot of respect, because you have to actually control for even genetic factors. But it looks like work for some older workers are killing them. And there is some data that show that work for people at lower socioeconomic class at older ages hastens death and morbidity. I'm not going to show evidence for that, but there is a literature on that. The next slide. Therefore, policies that might help older workers are policies directed at getting them not to claim Social Security early. So we expanded the earned income tax credit to older workers and to workers without children, keep that permanent. You want to somehow fill up that income, even though taxpayers are paying for it and not employers. Employers should be doing it. But we really want to do everything we can to get people to delay their Social Security. The problem is that EITC just creates more low-wage employers, which are a scourge to the economy, than a problem we have to solve. So solving one problem creates another one. You can advance the slide a little bit more. And I am running out of time. Here are a lot of relevant papers. So if you download the slides, you can get some of the winners on the morbidity and mortality. And we could talk about expanding Medicare by lowering the Medicare age. That's a really important topic, but for later. So I'm at my time a little bit over, and I am really eager to hear what my respondents and what the audience are going to say about this.
Great, thank you so much, Teresa. This was really helpful and insightful. And so next, I'm going to pass the mic to Dr. Mo Wang. So Mo, the floor is yours.
Oh, can you advance the slide to where my slide? Yes. So I'm gonna provide some reactions based on a psychosocial perspective. So what Teresa presented more or less represent more sociological and policy perspective. So I want to map onto it with a psychosocial perspective. So first of all, from the psych side, I think for individuals, reasons behind working longer, they are actually heterogeneous, right? So a lot of people, they work longer because of the poverty, right? Because they don't have sufficient income to retire. And a lot of people, they work longer because they don't have sufficient health benefits, right, to sustain their health care. Also, some people view work as a very important part of meaning of life, and some other people don't think that way. And also, people work to gain autonomy and to be surrounded by their friends and peers at work, right? So people have different motivational orientations to work longer. However, those reasons are heterogeneous, and thinking about like people as a whole, the homogeneous block, it is probably not going to help a lot to understand the working longer phenomenon. Okay, can we go to the next slide, please? So the second aspect is working longer is also an issue from the employer side, right? So employers, their practices create important contexts for people to decide whether they want to work longer or not. So there's plenty of evidence to show that age-inclusive management can help people to extend their work life. Peer mentoring makes people feel like their knowledge sharing and their expertise are well used. Participative decision making often giving older workers more voice at work. And then also organizations that are actively trained to counter age-related stereotypes also help facilitate workers to work longer. So again, another piece of the puzzle is actually from the employer side. Okay, please advance the slide. Oh, can you? Yeah. Okay. So the last point I want to make is really this is the place we can actually introduce that person environment fit approach for extending workforce participation. So instead of just always say like working longer is better, what we should have is a striving for fit perspective. So really to in terms of productivity, we want to consider the demands ability fit, right? So basically the job demands has to match the older workers' capabilities, right? So when you have that kind of fit, you have the best optimized productivity. But at the same time, we also need to pay attention to well-being, right? So this speaks to the need supplies fit, right? So whether the job supplies to older workers' needs. So when we have this more balanced the person job fit, we're more likely to see what I would call more positive working longer. So those are my reactions to Teresa's presentation. Thank you.
Okay, thank you so much, Mo. And last but not least, we have Dr. Courtney Coyle. So Courtney, on to you.
Thank you. I wanted to offer another economics perspective, bookending the psychosocial perspective in the middle, and mostly speak in response to Teresa's comments, but also offer a few comments at the end about how older workers are faring in the pandemic, which I think we're all quite interested in. So I appreciate Teresa's presentation very much. And I think on the one hand, working longer is a reasonable response to rising life expectancy. We may not want to have the expectation that the working life would rise 1-for-1 with the length of life, but we can also appreciate that if it doesn't go up at all, this will create a strain on public and private resources to fund that extra consumption during that extra period of life. And so policies like raising the Social Security retirement age periodically or indexing it to life expectancy reflect that expectation that longer work lives would be accompanying a longer length of life. And there's also been research, and it's just common sense as well, I think, showing that at the level of the individual worker, for people who can work longer, that is usually, and therefore delay their Social Security benefit claim and the drawdown of retirement savings, that's usually the single best way for someone to boost their personal financial security in retirement. On the other hand, coming to Teresa's excellent points, it's really important to think beyond just sort of the average worker and think about the heterogeneity in the workforce. As she showed us in, I think, what she called her money shot, those increases in life expectancy are occurring really disproportionately at the top of the income distribution. And that does beg the question of whether it's reasonable to be expecting longer work lives from all workers. And of course, we want to be mindful that there are always going to be those individuals who can't work longer, whether that's due to poor health or poor labor market prospects. So it's important to closely scrutinize our disability insurance and unemployment insurance systems and make sure that they provide protection to those workers who can't work longer, while also hopefully being designed in such a way to minimize use of those programs by the people who still can work. So I wanted to use my remaining time to briefly talk about 4 categories of policies that I think can be helpful for addressing inequality and working longer. And obviously there's a lot of policies, so I'll just sort of go over them relatively briefly, but hopefully food for thought. So the first category is policies that can enhance retirement resources. We want people to arrive at retirement either with a larger stock of assets or with the claim to what we think of as a larger annuity stream, that is benefits that are going to last over their whole life, whether that's coming from Social Security or pension. Because if people have that, then they'll be in a better position to adequately fund their own retirement. And there have been some really positive developments already, like policy changes that encourage firms to auto-enroll more of their workers in 401k type plans, auto-escalate those contributions so that they rise over time, and also default their workers into investments like target date funds rather than money market accounts that will allow them to build more wealth over time. But we can do more, and we could have greater expansion of auto IRA programs that can help to reach workers that are not currently covered by employer-sponsored pensions. Now, there's lots of details to work out, and I think those details are really important. What should the contribution rate be? Should contributions automatically increase over time? Should people be able to access funds in those accounts for non-retirement purposes like buying a house or paying college tuition? That might both make those accounts more attractive for people to save in the first place, but also drain the accounts prior to retirement. So I think different states will make different choices, and we can learn from experimentation in the states. Another way to boost retirement resources would be to think about changes in the Social Security benefit formula that would raise the benefit for workers, especially workers with long careers at low wages. It seems like a reasonable goal that a worker with that type of career should have an adequate Social Security benefit to not be in poverty. And so we may want to think about tweaks to the Social Security formula that will kind of have that objective. A second broad category would be policies that support work in late midlife, however you want to define that, say age 50 plus or 45 plus. I think job training is one area where more work is needed to understand how this can benefit older workers and what job training programs that are designed for them should look like. On the one hand, we want to be mindful that such workers have a shorter expected duration of time in the workforce, and so there's less time for any investments in job training to pay off. That doesn't mean that those investments aren't worthwhile, however. It seems very plausible that a well-designed program that can help a displaced worker find a new job and perhaps not end up on a government program like SSDI could be a net saver of government resources. So I think we need more research on job training programs. Another area in this category we could think more about is policies to encourage employers to better support their workers at the time of a disability onset. And we can look to some international examples. In the Netherlands, for example, the employer is responsible for paying the disability benefits for the first 2 years that the worker is disabled. This gives them a financial incentive to try to find a way to accommodate the worker on the job rather than moving them on to the public program. Of course, we want to be mindful as well of not designing our programs in such a way that discourage firms from hiring workers with health issues in the first place. So, more analysis of these international experiences, maybe even experimenting with some of these policies here could be helpful. My third broad category is policies to incentivize work at older ages. And there's lots of things that have been suggested here. So I'm thinking about things like eliminating Social Security payroll taxes beyond some age or after some number of years of contributions, making changes to the Social Security retirement earnings test so that it's not perceived as being a tax on work, expanding the earned income tax credit to apply to people without children at home, and making Medicare the first payer for people who have private health insurance to lower the cost to employers of insuring such workers. And my final category would be policies that make your retirement resources go further. And here I think many things could be done to lower healthcare costs, which are such a big expense for older individuals. So things like lowering the Medicare eligibility age, enhancing Medicare with dental, vision, and hearing benefits or with better coverage for co-payments, and providing more support for home health and long-term care expenses. All of these policies would come with a cost and potentially a very substantial price tag, but they would represent a really important strengthening of our network of social insurance programs in the US, which currently leave people unprotected against these very substantial risks. And so I just want to close briefly with a few thoughts about older workers in the pandemic. So here's what we know and what we don't know. There's been an increase in retirement during the pandemic, so people are retiring earlier. I think what we don't fully understand at this point is why. Some of my own past work, and that done by other people as well, has shown that retirement is what we call cyclically sensitive, meaning that people are more likely to retire in times and places when unemployment is higher. And so in the context of the current pandemic, what we would would expect is that in states where the unemployment rate has risen by more, we would also expect retirements to have risen by more. In fact, however, in my own recent work, I haven't found this to be true. And I also have not found a relationship between the level of COVID cases and retirement. So what it looks like is that people are retiring earlier during the pandemic, but it's happening in more of a common way across the United States rather than more so in places that are experiencing more unemployment or more COVID. So this could be because of common health concerns shared by all older workers, common policies like the stimulus and extended unemployment insurance benefits, or for other reasons. So I think more research will be needed to figure this out. So I just want to leave you with the thought that even though we don't completely understand why people are retiring earlier in the current pandemic, the fact that this is happening can be a cause for concern. Some of my past work shows that if the unemployment rate is higher when people are in those sort of early retirement ages around 60 or 62, and then you follow those people into later life, they're going to have lower income 15 years later when they're in their mid to late 70s, and they also die younger on average. So the kind of early retirement that we're seeing during the pandemic does matter. And I hope that some of the policies that I mentioned before could potentially be helpful in protecting people from some of the effects of pandemic-related early retirement. And with that, I'll throw it back to Cal. Thanks so much.
Okay, thanks so much, Courtney. So please keep your questions coming in because we are monitoring those. So the first question that we received relates to one of the charts that you had, Teresa. And this person is asking, I'm curious about the chart that Dr. Ghilarducci shared about the retirement and healthy retirement age gaps among race and SES. I get that education level is a common metric of socioeconomic status, but I wonder if the chart might be starker if we saw differences among job types, including informal employment, as an example. Could you speak a little bit to that?
Yeah, that's my money slide. The inequality of retirement time and healthy retirement time and the ability to retire. I'm very mindful of having enough sample size in order to make those distinctions, but it looks as if the pattern is, as the questioner intuited, that if you look at people in service sector jobs, especially without a college education, my student did this with ONET data, found that the stress of being an older woman, especially in service sector jobs, actually hastened health outcomes, like mainly cortisol level increases, which when we follow them and they finally die in the HRS, we'll probably see foreshortened life. But right now, there is a relationship between the kind of job you have and cortisol levels in the HRS. Now that I have the mic, just one thing I want to respond to Courtney. Courtney, I think that we can do a lot together as we go forward. We want to incentivize work, but we want policies that make work better. I just really has gelled here. Now, policies that could make work worse for older people would be eroding their pensions by raising the Social Security retirement age, or even raising that early retirement collection date of 62. So that's off the table. The other thing that could make work worse, is any policies that don't expand pension benefits. Making pension benefits better gives more bargaining power to the older workers to actually get higher wages, improve their hours and their working conditions. The other thing that would make work better is make Medicare the first payer, so that when an employer hires an older worker, much of the healthcare costs are paid for by the government, not by their private insurance, which always charges more for an older worker. I fear that expanding the earned income tax credit may make work worse for older workers. It makes their income higher, but it makes their jobs worse because it encourages low-paid work, especially in personal home health care, janitorial services, and even truck driving.
Great. Thank you so much. And actually, then a follow-up question links to something you said about making work better. And so this I'll throw to Mo, but if others have anything to add, please do. So Mo, from your own research, you talked about the person environment fit and how important that is. So what are some specific examples that you've seen on how to increase this person-environment fit so we can actually make work better for older workers, even younger workers, so that they're healthier as they're older?
So, for example, in terms of physical demands at job, right? So there are a lot of accommodations that organizations can implement to make the physical demands more manageable for older workers, especially in terms of like heavy lifting, in terms of standing, and even in terms of like, oh, how hard the floor is, right? Because if the floor is really hard, it actually has impact on people's knee and joints when they work on it, when they walk on it. So so physical side, you have a lot of those, but then also the cognitive side and the psychological side, you can also implement softwares that's more adaptive to older workers' perception declines in terms of like a visual decline or in terms of the hearing declines. So yeah, so all those things, and a lot of those accommodations, they don't cost a lot. Actually, it's quite reasonable actually for organizations to implement that, and it would actually boost the productivity. So yeah, so those are the things that I think I think from the policy standpoint, the government can encourage the employers to adopt those and give some tax benefits, and it shouldn't be too hard for people to use it. So.
Thank you. And for another question that we have, again, gets back to the gap in the healthy life expectancies slide, and between the states and Washington, D.C., and it showed great variation. So one of the questions is, you know, in your research, what are you finding that's leading to these disparities? And then thinking about the implications, what are the implications for this in terms of the types of targeted policies that could actually be made to start to reduce these gaps?
Yeah, no, just as cursory, we really need more research on this. And so I'm actually showed the slide to spur more research. But here are some of the things that you can see, especially if you map it out. I expected it all to be in the South. I expected the racial healthy life gaps to be worse in the South, but Iowa pops up as one of the worst. Well, that could be sample size. There's not a lot of Blacks in Iowa, but it actually could be just access to health. More rural areas have terrible strains, and we may find that video conferencing and other kinds of rural health initiatives may actually close that gap. In Iowa, there's lots of exposures to insecticides and other kinds of health hazards, so that could have a differential effects. Morbidity differences we're now exploring, right? The social determinants of health disparities, but I think that's what's showing up here. So the research on the health disparities by social standards will help inform that. But it's not your typical map. It's not just the South. It's all over the place. And then when we add Latino designations, I think we'll find some really important issues around housing accommodations and lifestyle. I really like where this webinar is going, where we're talking about how to make work better for older workers. I think we crept up to that. And so I want to ask Mo a question if I can, Cal. Do you know research, or have you done it yourself, to tell the Biden administration what has to be done in OSHA standards to make work better for older workers?
Oh, actually, OSHA has, so actually NIOSH, so National Institute of Occupational Health and Safety, they actually have this practice guidance in terms of total worker health. So it's not just about older workers, but actually those guidance apply to older workers extremely well. Mm-hmm. So the total worker health actually pays attention to not just the physical health, but also the psychological health, and the cognitive aspects of the health, and also the industrial hygiene issues. So basically, organizations should be mindful that when they implement any health-related policies, they should not just focus on one aspect, but they should think about how different policies would coordinate with each other, and also can create a cohesive practice bundle, so that actually workers actually will experience consistency in those policies, and also every aspect of their health will be promoted. So yeah, so if people are interested, I highly recommend to check out the total worker health approach. I actually think it's very effective. There's a lot of evidence, empirical evidence supporting it. And I think that right now it's a guidance. I don't think it's a policy, but yeah, but I think well, that has a lot of potential. So.
Yeah, and I can actually say regarding total worker health, I just became familiar with that about a year ago, and actually starting pretty soon a grant under NIOSH, the National Institute for Occupational Safety and Health, using total worker health as a framework for older workers and making work better. Courtney, I think were you just about to say something?
I was just going to jump in and say, as someone who likes to think about the policy angle and the role for government, so I appreciate hearing the perspective about how regulation could be helpful, and it also just makes me think maybe we want to go further and have grants to encourage employers to kind of make these kind of investments. On the one hand, as Mo's saying, these could be things that actually the employer should be happy to do themselves, because they might even be cost effective when only analyzed from the perspective of the employer in terms of you know, productivity or savings on you know, having healthier workers or so on. But especially when you take the social perspective and you add in the benefits that wouldn't accrue directly to the worker, but to the society at large from having, you know, healthier workers is going to rebound in terms of lower Medicaid costs, Medicare costs and so on. There could really be a case for in trying to encourage employers to make these investments that would make work healthier and safer for everybody, but maybe for older workers especially.
I just have to point out that decades of research shows that to make health and safety standards really stick, you need two things. You can encourage employers and show them the way, but unionization and having labor management committees to enforce those standards really helps improve health and improve productivity. Also, NIOSH policies moving into OSHA penalties would help employers pave the way when we give them a grant to see how they can make the workplace more friendly. Both are really necessary, not one without the other. So this is a really good direction.
And actually, speaking of some of these programs, even at the employer level, one attendee just asked, you know, so how do you actually get employers to implement programs and policies for older workers? Because we've been touting the benefits of such policies and programs for about 40 years with very little action actually taken. So how do we go about doing this?
So one trial I've seen before was actually the organization partner with the insurance company. So really do an audit in terms of like how much they can save by actually implementing certain good policies. There are data available from Finland, from a lot of Scandinavian countries. Actually, they do this kind of health audit. They actually show like, hey, implementing certain policy, like for example, ask the workers to actually take more breaks, actually how that translates into dollar values. I've seen such trials in US at the organizational level as well. But the thing is, oftentimes you need the insurance company to join in the US, because if the insurance company is not a partner with you, it's really hard for organizations to calculate how much they can save, right? At the end of the day, for organizations, they need to pay attention to their bottom line, right? So, but I think we should encourage this kind of partnership. And I think based on the data we see from the Europe, we are more likely with this kind of partnership, we can actually make some positive changes.
But that partnership happens when employers have to pay a higher premium, insurance premium, for having unhealthy standards. So maybe expanding worker comp benefits, if older workers could actually get worker comp benefits, or the employer would be assessed a higher premium. I just want to take you on top of a mountain over a coal mine, and I saw how unions actually help employers accommodate older workers. Under the United Mine Workers contract, as you get older, you have some seniority privileges, but the seniority privileges are that you move into more age-appropriate jobs. And so the oldest worker in the workplace is the one who's above ground, and he's running what's called the man trips, the little carts that take the men and women underneath the mountain. So the union works with the employer to create a seniority structure that makes the job more relatable, to their age. And that's when it dawned on me, oh, that's what seniority clauses do. So we need, again, my regressions show it, these institutions really do help establish the workplace.
And one attendee actually mentioned that, just to throw this out there, that workers' compensation policy also plays a huge role in this issue, just from this attendee's former role as a business insurance advisor, advised on workers' comp. So one of the, moving forward, and a lot of this has happened since, increased since COVID, but with remote work, how do you see remote work playing a role in the discussions that we're having today and creating a good place for people to age in their jobs?
So we just had a seminar with Courtney yesterday, and this was brought up. And then after that seminar, we looked to see what the occupations are providing the most job growth. So you look in the next 10 years, you look at the United States economy, and you see which jobs are not growing the fastest, but have the most predicted employment growth. And on the top of the list are personal and home health aides. That's 1.3 million more jobs will be created in that area. And that job category is disproportionately older. Over like a third of those jobs will be taken up by workers over 55. That can't be done remotely. You look down the list, nursing, physician's assistants, janitors, security guards. I was really shocked to see that the jobs that we're going to add to the economy can't be done remotely. So though I was hopeful and I really liked staying home and teaching my classes, I can just snack all day. It's not a reality for actually the population that may need to, for all of those great reasons, have to work longer or want to work longer. It's not going to be remote work. So I like this idea of really puffing up the research at NIOSH and then moving those findings to the insurance world and to OSHA.
And another question we had relates to, for those who need to work longer or want to work longer, and then those who actually can and do, we might end up running into a situation where we have more and more people, as they're working and aging on the job, start to develop Alzheimer's or related dementias. What research have you seen relating to this topic? And I wasn't sure who to direct that to, by the way.
I could try to jump in. It's a hard question. My recollection, so the fraction of Alzheimer's cases that are occurring, below age 65 or 60 is quite small. So it's not, the most important implications of Alzheimer's. There are many important implications of rising Alzheimer's for our society, but sort of a threat to the people's ability to kind of retire at the intended time. It's not a major. It's not a major one at present. But I totally understand the spirit of the question, which is that the as we keep working longer, there are going to be more people who will develop Alzheimer's. I think that there's interesting work trying to, for example, help us see if we can identify Alzheimer's at an earlier stage in creative ways. This is maybe a little distinct from the question, but there's some really interesting work showing that if you track people's things like credit scores and making what might be termed financial mistakes, missing payments and overdrafts and things like that, that's actually an early warning indicator of Alzheimer's. And it's, especially if we ever do get to the point where there's effective treatments to slow the course of the disease, which really isn't currently the case, there would be even more reason to try to do a better job of picking things up at an earlier stage. So I don't think it feels like a major sort of threat to the people's ability to work longer, but but we should keep an eye on it because perhaps it could change. I don't know if Mo or Teresa have any additional thoughts there.
So I have students who actually try to search for literature on that, and because Alzheimer is actually low base rate onset when people are relatively younger, so you don't see a lot of empirical study on like people, older workers, how they interact with the Alzheimer conditions. So I would say like if we incorporate this into like the total worker health paradigm, right? So then it will actually promote a lot of work the employers to pay attention to the early identification of the disease and also the prevention or like early treatment strategy for it. But right now we don't have a lot of empirical evidence. It's actually difficult to collect those kind of data. Yeah, go ahead.
I'm actually really worried about the causation going the other way, is that I'm seeing this. I just was preparing an NIH grant to look at cognitive decline and financial management, but also to look at the nature of work and the causing early onset or intensification of cognitive decline. And I think the literature on the social determinants of health also are expanding to the social determinants of Alzheimer's and other cognitive decline and senility. And we're finding that work is implicated. And so when we can match ONET, which is occupational aspects of the job, especially in terms of hierarchy. If you worked your whole life at the bottom of a hierarchy and subject to the winds intensification of your supervisor and don't have autonomy over the pace of control of your content of your work, that leads to cortisol increases. It may also, with more detection, lead to early to dementia. So we're seeing that higher educated people who are engaged are less likely to get Alzheimer's at early ages. Well, the reverse is true. So I'm worried about work killing.
I just wanted to quickly say I forgot to mention the sort of more perhaps direct or indirect, but probably bigger impact of Alzheimer's on the workforce is the caregiving, right? So it's not the Alzheimer's patient themselves, it's the next generation down that has caregiving responsibilities. And again, because I always think about policies, there's the possibility of something like paid family leave, even though Alzheimer's is a sort of progressive degenerative disease, but maybe to help people manage some gap of time when the elderly relative, needs caregiving at home before the disease progresses such that they need to be in long-term care. So policies like that can be helpful, as well as just in general more, more public financing for home health care and long-term care.
Okay, well, there's actually some more questions, but we do run a tight ship here. So I just want to thank Drs. Ghilarducci, Wong, and Coyle for their time today, as well as everyone for attending. So please do contact us if there's any follow-up questions or comments. And with that, to keep us on time, I'm going to pass it back to Judy.
Thank you. I am so sorry that we're running out of time. A really big thank you to the panel and to our attendees. Thank you everyone for participating. This is the end of the program.